Good evening. Health officials in Ontario continue their work to contain the spread of COVID-19 as the province confirms 3 new positive cases, bringing the total number of positive cases here in Ontario to 11. More on that shortly, but first, staff and students at a Midtown ESL center are left wondering whether they were exposed to the potentially deadly virus after receiving a notice from Toronto Public Health. City News obtained this letter dated Thursday the 27th and addressed to staff and students at ESL and Link Center that's located near Yonge and Eglinton. It reads in part, "This letter is to inform you that you may have been exposed to someone who has the 2019 novel coronavirus, COVID-19. This individual last attended the facility on February 25th and did not have symptoms on that day." The letter goes on to say that those affected should monitor their symptoms over the next 14 days with instructions on what to do should symptoms develop. A TPH spokesperson says sometimes letters like these are issued as part of their routine work for all public health investigations related to communicable diseases, including COVID-19. Dr. Vanita Dubé adds that because of privacy, they cannot share specifics of the situation.
I just would ask people to remain calm.
Speaking separately on COVID-19 earlier in the day, Mayor John Tory said he believes health officials are prepared should a local outbreak occur, especially given the lessons of SARS.
I'm confident as of this moment that the answer is yes. They're making those plans. They have plans.
On Saturday, the province confirmed 3 new positive cases of the virus. The first, a 34-year-old woman. Officials say she returned to Toronto from Iran with a layover in Denmark on Wednesday, February 26th. She then boarded a GO bus to Richmond Hill Centre Terminal. She presented herself to Mackenzie Health the next day with symptoms, but was wearing a mask. She is currently in self-isolation.
All those individuals who traveled in the business class sections of Qatar Airways, flights QR 483 or 163, Air Canada flight AC 883, or GO bus 40, traveling eastbound and sitting on the upper deck, may have been exposed to this positive case of COVID-19. And we're asking them to contact York Region Public Health.
The other 2 cases, a husband and wife in Ajax. Officials say the 51-year-old woman returned to Toronto from Iran on the 22nd and went to an Ajax clinic on the 28th, where she was masked and transferred to Lakeridge. Her 69-year-old husband, who did not travel to Iran, also tested positive for the virus. They are both in self-isolation. The cases come hours after BC confirmed its 8th positive case, a woman in her 60s visiting from Iran, bringing the total number of confirmed cases in Canada so far to 19. Now, though there are 11 confirmed cases in Ontario, the first 3 patients, those cases are resolved. That means to say that those patients had 2 consecutive negative tests at least 24 hours apart. BC health officials also say their first 4 cases have been resolved. Now, coming up, we speak to a travel expert because March break is just around the corner. We talked to him about whether you should cancel those March break plans and whether there may be different protocols at the airport.